Hello everyone, I'm Alan Patlán. I currently work for Action Against Hunger France, which as well as many other organizations and institutions around the world, is concerned about the impacts of climate change on populations' health, especially when it comes to the most vulnerable ones. Climate change have impact on nutrition and health through different pathways. Some of them are the availability of water resources, food security, and the frequency and distribution of water-related diseases. When we focus on Madagascar, we observe that this country has the second highest child mortality rate worldwide due to malnutrition and the world's third highest child dialysis rate due to nutritional deficiencies, which makes undernutrition one of the public health priorities for this country. Furthermore, diarrheal diseases and low respiratory infections have remained the first two causes of death in this country since 1990. In the southwest of Madagascar, the population already faces important economic and social issues and is additionally facing negative impacts of climate change on their nutritional status and health. Despite these observed negative impacts, not only in Madagascar but in many other zones around the world, climate monitoring is still not enough, and the evidence produced so far does not allow us to fully understand the relationship between acute malnutrition and climate. These climate change effects on populations' health and the vulnerability and current emergency in southern Madagascar have led ACF to integrate this project, which started with the installation of an hydro-climatic observatory by ACF France in consortium with the Ministry of Water, Sanitation and Hygiene, the Malagasy Meteorology Direction, the University of Antananarivo, and the University of Toliara. This observatory is composed of 12 piezometric proofs and two meteorological stations distributed on three sites. This project aims to explore and characterize the associations between monthly estimates of hydroclimatic variables with climate-sensitive diseases morbidity indicators, including undernutrition, evaluating their potential use in terms of public health surveillance and forecasting in southern Madagascar. For the first stage of this research project, we conducted a retrospective observational study based on hydroclimatic and nutritional data from the district of Ijiki-Yatsimo in Madagascar from January 2014 to December 2019. Hydroclimatic variables were mean monthly pluviometry, monthly piezometric index, monthly leaf area index, while nutritional status data were represented by the number of admissions to centers for outpatient nutritional rehabilitation for severe acute malnutrition called CRENAS, and the number of screened children with acute malnutrition. The piezometric index and the total rainfall in the region were obtained from Action Against Hunger Hydroclimatic Observatory, GROSOM, and from the MERGE climatic model. The leaf area index was obtained from Copernicus remote sensing, and nutritional and health data of children aged from 6 to 59 months were extracted from health information system databases and ambulatory nutrition rehabilitation centers repositories. To assess the relationship between our variables, we use cross-correlation function, while for the next steps of our analysis and modeling, time series regression will be used. In the next graphics, we can observe the evolution of data from January 2014 to December 2019 for the monthly leaf area index at the top, then for the monthly piezometric index, then for the monthly cumulative rainfall, and finally for the monthly admissions due to diarrhea, acute respiratory infections, malaria, and severe acute malnutrition. Gaps in the health data are due to difficulties in retrieving those data. We will try to complete the data through an upcoming data collection. In those graphics, we can clearly observe that the hydroclimatic indicators follow a seasonal pattern, but also that there exists an interannual variability, which is something expected for the hydroclimatic variables. If we consider a linear relationship between all the variables, we could say that from those graphics that the increases of the cases of malnutrition are related with the increases in the hydroclimatic indicators. However, that is not consistent with the field observations nor with the existing literature. Therefore, we hypothesize that there are there is a plausible lagged association between the hydro-climatic variables and the acute malnutrition occurrence, especially when considering decreases in the groundwater levels. The next graphics represent the monthly evolution of the number of cases of diarrhea, acute respiratory infections, malaria, and severe acute malnutrition in children under 5 years old from January 2016 to December 2019. We can see here that the beginning of each year is often marked by increased admissions of diarrhea, acute respiratory infections, and severe acute malnutrition. These trends will fluctuate and decline for the rest of the year. Malaria trends will vary throughout the year, having an important peak in the middle of 2017 and 2018. This graph also represents the monthly evolution of the number of cases of the previously mentioned diseases. However, if we superimpose the trends, the peaks we observe for severe acute malnutrition seem to appear at the same time or just after those of diarrhea and the acute respiratory infections, notably in 2017 and 2019. The relationship between the diseases included in this study will be also assessed during further analysis to prove these correlations. A cross-correlation function allowed us to assess the plausible temporal correlation of the variables. Preliminary analysis with available data showed that rainfall and the leaf area index are positively correlated with the admissions due to severe acute malnutrition, meaning that increases in the leaf area index and rainfall causes increases in the number of admissions due to severe acute malnutrition, which is not consistent with the field observations and with the results of previous studies. However, we can see other statistically significant negative correlations, and therefore a multivariate analysis is necessary to assess the effect of the full set of variables and to remove potential effect modifiers. On the other hand, significant increases in the number of admissions due to severe acute malnutrition are negatively correlated with the decreases in the piezometric index for months before. To our knowledge, this is the first study that aims to assess and characterize the impacts of climate change and climate variability on health centers admissions due to acute malnutrition in southern Madagascar. These preliminary results are part of a wider study for which we'll perform more robust analysis, including other factors and morbidity indicators that play an important role on the pathway to malnutrition and that could be impacted by the climate variabilities, such as the diseases mentioned before. Nevertheless, these preliminary results are consistent with previous evidence of lagged impacts of climate on health indicators. However, the evidence on climate variability and undernutrition is still scarce. Based on the available data, we could identify a significant negative association between the monthly piezometric index and the monthly admissions due to severe acute malnutrition in the district of Betioky at Simo, also identifying that these are lagged associations as shown in the last cross-correlogram graphic. These findings point out to the potential utility of groundwater monitoring in anticipating health and water crises in contexts facing chronic droughts. The continuity of this project and its research component will help to enhance the groundwater monitoring and public health surveillance. With a potential replicability in similar humanitarian contexts, it will also improve forecasting of health indicators through hydro-climatic surveillance, also guiding timely interventions before health and water crises occur in southern Madagascar. For this, we will perform more robust analysis, including also indicators on climate-sensitive diseases and complementary hydro-climatic and nutritional indicators from the 8 districts in southern Madagascar. That concludes my presentation. Thank you very much for your attention.